Hello, everyone. A very good afternoon to all of you. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, benign prostatic hyperplasia.
Uh,
So, doctor, today we are going to talk about BPH. BPH पर आज हम बात करेंगे और चूंकि हम benign prostatic hyperplasia पर जिसे आमतौर पर prostate enlargement भी कहा जाता है, prostate का बढ़ना भी कहा जाता है आम भाषा में, उस पर बात करेंगे। तो सबसे पहले तो ये समझ लेना जरूरी होगा मेरे ख्याल से कि prostate आखिर क्या है। डॉक्टर, उस पर अगर आप थोड़ी रोशनी डालें।
okay. See, urinary bag, right? So
Right.
just below the bladder, there is a one gland for secretion. So that is called prostate, and our urinary tube that is called urethra, which is going through the prostate. Okay, so whenever this gland is enlarged, so what will happen? There will be a problem with the urinary streams. So basically, it's a part of the male anatomy. It's a part of the male physiology for the normal secretion through the urethra, or you can say the content of the semen, normal semen. So it's a very important structure or organ in the males, also responsible for production of the testosterone. Testosterone means it's like a male hormone which is responsible for all this the external features and the development of the males. Okay, so there are various functions of that gland, so which is important for the males.
Right. So you have very well explained, doctor, that what is prostate and how important it is as a male organ, male gland, and where is its position. Now, doctor, because we are going to talk about BPH throughout these sessions, so very important thing that we would like to understand it: what causes BPH? BPH होता क्यों है?
See, this BPH means it's called benign prostatic hyperplasia. That means the size of the gland is increasing, and many times even has size is small, but still we are getting the complaints. Okay, so basically the reason for the BPH is mostly age-related issue. It's age-related issue. Whenever there is a advance in the age, it will lead to low testosterone in the body, and it will lead to hyperplasia of the gland. That means the size is going to increase by low testosterone level in the body. So that is a most important, the first factor for BPH. The rest risk factors like it's genetical issues or inflammatory problems. Sometimes chronic prostatitis also can lead to all this stuff. Okay, so these are the common reasons for BPH, but mainly it's a age-related issue.
Right. So it can be taken as a sign of aging, that just the way we, our hairs gray after a certain amount of time or after a certain amount of age, or we get wrinkles on our face. So prostate enlargement can also be associated with the sign of aging. We'll talk about it in detail, but before that, doctor, these symptoms associated. What are these symptoms that can make anybody think that it may be enlargement of prostate?
See, mainly if patient present at initial stage of the BPH, mostly they will have some hesitancy, difficult to pass the urine. Sometimes there will be urgency to pass the urine, and flow will be okay initially. But if we compare the late presenters, like if patient comes late with the BPH symptoms, there will be a significant poor stream of urine, like flow will be very less. Then there will be a significant hesitancy. The night symptoms will be more like nocturia. That is called nocturia. Patient will wake up 3, 4, 5 times in a night for urination. And many storage symptoms like urgency, frequency, and so many other symptoms can associate, but mainly will be voiding problems and storage problems.
Many a times we have seen people who have these similar symptoms, of frequency or urgency or getting up again and again during their night, they say that, I am a diabetic, so I'm bound to have these symptoms, or I'm aging, so I'm supposed to have these symptoms. So many times they would associate it with their prostate, they'll associate it as a sign of aging. Okay, prostate enlargement is also a sign of aging. But to live with it, to live with the symptoms, how okay is that, doctor?
I would say it's absolutely not okay, because even with age increases, if the symptoms are severe, then definitely we have to look after. We have to check properly what is a post-COVID residue. We have to evaluate thoroughly by ultrasound and urine reports and so on. And then we have to treat. If we treat this kind of patients in the early stage, then we can manage this patient with the medications. Otherwise, they will end up in the surgery. So it's not like with age there will be a frequency, nocturia, diabetes, and so on. We have to see the severity of the symptoms, and then we have to evaluate and treat accordingly. We cannot live like that.
Right. So it's important to get it treated, and there are treatment options available. Now, doctor, we have seen many a times there is no symptom, but then enlargement of prostate is there. For example, person after a certain age, when they go for their, annual check, ultrasounds, etc., that's when they get to know that their prostate has enlarged in size, but they have no symptoms. When such patients come to you with their reports in hand, what is your take on that?
See, generally, if they says there is no problem with the urination, we don't do further evaluation and treatment. But for the completion of the evaluation, generally we do uroflowmetry, because most of the time these patients having only ultrasound. They're showing some 45 cc, 50 cc, and some enlargement of the prostate. But we will see what is a post-word residue there, and we will see the uroflowmetry of that patient, and then accordingly we will take a call. If flow is okay, then we will not start any treatment for the now. And if on follow-up, if he requires, then we can start some medications. If the flow is very poor, then directly we'll go and start the medication initially, and then we will follow the patients at the 1.5 month, 3 months, and so on. So
Right.
if you are diagnosed with BPH in annual checkup without any symptoms, then just get one uroflowmetry and then proceed further.
Right. So probably you don't need any treatment, but just for making it more safer, that it's okay, no problem at all, you should go and consult a urologist. And in case you have these symptoms and you are a male, please make it a point to go to a urologist, a qualified urologist. It's very important. Now, as we were talking, doctor, that many a times people take it very lightly, or they are now so habitual with these, symptoms of urgency, frequency, nocturia, etc., that they often ask that if we keep it untreated, what would be the potential complications? We'll talk about it. I think there is some network issue, and we have lost our expert, Dr. Nayan Timbadiya, right now, but I'm sure he'll join back. So today, we are talking about BPH, benign prostate हाइपरप्लेसिया, बेनाइन प्रोस्टेटिक हाइपरप्लेसिया, बीपीएच, और जिसे बहुत आम भाषा में हम कहते हैं कि प्रोस्टेट बढ़ गया है या एनलार्जमेंट ऑफ प्रोस्टेट। और चूंकि हम बेनाइन प्रोस्टेटिक हाइपरप्लेसिया पे बात कर रहे हैं, तो ये जान लेना बहुत जरूरी है कि ये बेनाइन है, ये नॉन कैंसरस है। प्रोस्टेट कैंसर भी होता है, उस पर भी हम थोड़ी बात करेंगे, लेकिन वो अलग है। अभी जिस पर जो बहुत कॉमन है, जिसे एक साइन ऑफ एजिंग के तौर पे देखना चाहिए, जो होता ही है एक सर्टेन एज के बाद, क्योंकि ये एक मेल ऑर्गन है, पुरुषों में होता है, और ऐसे में एनलार्जमेंट जब होता है एक सर्टेन अमाउंट ऑफ एज के बाद, मे बी 50 और 55 इयर्स ऑफ एज के बाद, तब कुछ जो सिम्टम्स है, फ्रीक्वेंसी, अर्जेंसी, नक्टूरिया, बार बार रात में उठना पड़ता है अपने आप को वॉइड करने के लिए, यूरिनेट करने के लिए, तो ये जो सिम्टम्स हैं, इन्हें इग्नोर करना बिल्कुल भी सही नहीं है। जरूरत है कि अगर ये सिम्टम्स हैं तो हम एक डॉक्टर को दिखाएं, क्योंकि बहुत जरूरी है कि बीपीएच का प्रॉपर इलाज हो। हम आज बात कर रहे हैं बेनाइन प्रोस्टेटिक हाइपरप्लेसिया पर, और हमारे जो एक्सपर्ट आज हमारे साथ है, यूरोलॉजिस्ट डॉक्टर नयन तिम्बाड़िया। कुछ नेटवर्क इशू के चलते उनसे कनेक्शन हमारा टूट गया है, लेकिन हम पूरी कोशिश कर रहे हैं कि एक बार फिर डॉक्टर नयन हमको ज्वाइन कर पाए इस सेशन में और हम उनसे कुछ और बातें भी जाने। अभी तक जो बात डॉक्टर नैन ने बताई वो ये है कि अगर ये सिम्टम्स है तो इन्हें इग्नोर ना करें, इन्हें लाइटली ना लें, इन्हें ये ना समझे कि हमें तो ये होगा ही एक आफ्टर सर्टेन अमाउंट ऑफ एज। तो ऐसा नहीं है कि आपको इन सिम्टम्स के साथ रहना ही पड़ेगा, क्योंकि इसका इलाज संभव है। और कई बार तो बहुत जो ट्रीटमेंट है वो सिर्फ लाइफस्टाइल मॉडिफिकेशन से ही सब मैनेज हो जाता है, या फिर थोड़ी बहुत दवाइयाँ। सर्जरी की नौबत बहुत बाद में आती है, और जिस तरह से एडवांस टेक्नोलॉजी हो गई है, मेडिकल साइंस में इतना एडवांसमेंट हो गया है कि जो सर्जरीज हैं वो भी बहुत बहुत आसान हो गई हैं। तो बहुत दिक्कत की बात नहीं है, परेशानी की बात तो बिल्कुल भी नहीं है। अगर आपको ये सिम्टम्स हैं तो डॉक्टर के पास जरूर जाइए, एक अच्छे यूरोलॉजिस्ट के पास जाइए, ये बहुत जरूरी है। मान लीजिए आपको ये सिम्टम्स नहीं है, लेकिन किसी वजह से आपने अल्ट्रासाउंड कराया एनुअल मेडिकल चेकअप के दौरान या किसी और ऑर्गन के लिए और आपको पता चलता है, तो भी आप डॉक्टर से जरूर संपर्क करें। डॉक्टर नैन, वेलकम बैक। आई थिंक देयर वाज सम नेटवर्क ग्लिच एंड वी लॉस्ट यू। अनम्यूट आपको करना होगा डॉक्टर, और अगर आप
Please,
लैंडस्केप मोड पे कर सके तो बहुत अच्छा होगा।
yeah, please continue.
एब्सोल्युटली परफेक्ट, या। तो डॉक्टर, हम बात कर रहे थे किस तरह से बीपीएच को अगर हम अनट्रीटेड छोड़ दें, जैसा कि हमने बात की दैट मेनी टाइम्स पीपल इग्नोर दीज सिम्टम्स, सो इन केस वी लीव इट अनट्रीटेड, व्हाट आर द पोटेंशियल कॉम्प्लिकेशंस?
See, mainly we see the complication like recurrent urinary tract infections. Sometimes they may develop the stone formation, bladder stones. Sometimes there will be, if two late presenters, they may have like underactive detrusor. Their bladder will go up. So this kind of the complications we are seeing. Sometimes patient may present with the renal failures, acute renal failures. There will be some bilateral hydronephrosis and pyelonephritis and so on. So these are the basic complications of late presentations. Most of the time they will present like urine is blocked. There will be a urinary retention. So we may have to go for Foley catheterization initially, and then after evaluation we do the surgical procedures.
Right. It could be really complicated. So the best way out is to, in case you have these symptoms, please do not hesitate. Do not suffer in silence. Go and talk to your doctor. Go and consult a qualified urologist, because, I'm sure there is treatment and you will get relief of your, symptoms. Now, doctor, talking about the treatment options, but before that, when a person comes to you with these symptoms, are there any tests to diagnose, or just by clinical physical investigation, you're sure ki, yeah, this is BPH and there is nothing to worry and this could be the, line of treatment?
See, generally we do like urine routine examination to check the infection first. Second, we do the ultrasound of the kidney, ureter, bladder, and prostate, along with the post-void residue. And then third is, as I told, uroflowmetry is the basic investigation for BPH to know the flow rate of the patient. And then sometime we do PSA after clinical examination. If we have any doubt of the hard prostate, doubt of any malignancy, then and then only we do PSA report. Otherwise, for routine patients like clinically benign prostate, we don't do PSA as a screening test. So these are the basic investigations for BPH, and then we have idea now whether patient needs the medical part.
Dr. Nen, if you can just check on your system, because I started getting your voice very low. So if you can just check once, and
Is it okay now?
yes, this is
Fine.
okay now. We would like you to explain it one more time, because
Okay.
you were not
So,
properly.
yeah, no problem. So basically, we do three basic tests for BPH. So the first one is urinary routine examination to check the infection. The second is we do the ultrasound of bladder and prostate along with the post-void residue to check the what is the status of the prostatic size and bladder thickness and so on. And the third important investigation is uroflowmetry, as I said. Uroflowmetry is the most important investigation for the BPH patients. So after these three basic investigation, we have some idea about the severity of the BPH. The fourth important is like serum PSA report. Basically, that PSA we do only when there is a doubt in the rectal examination, clinical examination for malignancy. Otherwise, as a routine screening test, we don't do the PSA for all the patients. So these are the basic investigation, and then we have idea about the BPH severity.
Right. And once it is established that it is BPH, then how do you decide the line of treatment and what are the treatment options available, doctor?
So basically, as I told, after this basic clinical examination and the evaluation like ultrasound and uroflow, we have to consider the symptoms of the patient. If patient symptoms are very minimal, then we can manage with the fluid intakes and timed voiding and constipation management and so on. No need of any medical management like alpha blockers. If patient's symptoms are like bothersome and our flow is showing very poor flow, ultrasound is showing then initially we start with the medications like
Sorry, I'm interrupting you, Dr. Nayan. If you can just recheck, because again, your voice is not coming.
right. So okay from my side.
Yeah. Now it is fine. Yes.
Okay. So basically, initially we start the medications. If patient presented to us with any complaint like poor flow and urgency and so on, after evaluation, we'll start medication like alpha blockers. And along with the alpha blocker, the most important treatment is like timed voiding, means every third hourly we advise to pass the urine. Then urotherapy means we have to restrict the fluid for this kind of patient, BPH patient, like 1.5 to 2 liters per day, including all these liquids like tea, coffee, or whatever. And the other important is avoid constipation. If patient having any constipation issue, only medication will not work. So along with the medication alpha blocker, we have to advise these three important things. I will repeat: time to voiding, urotherapy, and constipation management.
Right.
So
So
this is
lifestyle
the
management also goes a long way, doctor, in managing BPH.
so this medical management is like it's like lifetime. We cannot advise like you take for 2 months or 3 months and then you stop it. It's not like that. Once we have started the medical treatment like alpha blockers, he has to continue the alpha blocker for lifetime. If any problem with the alpha blocker, then he may need the surgical intervention. Most of the patient, our patient started by some physicians or surgeons alpha blocker, and then they will stop by himself. So that is the problem. So we have to continue the alpha blocker, and then periodically we have to check the flow and the ultrasound.
Okay. And what are the surgical options, doctor? Because, a very common fear in people is that they feel that immediately if I go to a doctor, they'll put me on the inside the OT and operate on me. And they are really scared of the term surgery. So because there's so much of advancements, technical advancements, I'm sure surgeries are not that scary anymore.
So as you told, nowadays the surgery is all endoscopic surgeries, and now anyway everyone knows laser is coming, already came in the urology. So there are laser surgery like HOLAP, TULAP, and so many other names are there. So this kind of endoscopic laser surgeries we can do now easily for the prostate. There is no open incision for the prostate, except there is a huge prostate like 150 or 200 cc. So when there is any complication related to BPH, whatever I have explained, like hydronephrosis, recurrent UTI, stone formation, this kind of patient definitely needs surgery. So we cannot give the medications for these patients. Once the patient develop the urinary blockade, like urinary retention, recurrent UTIs, or hydronephrosis, renal failure, directly we have to go and do the endoscopic procedures, whatever I have explained, like TURP, HOLAP, TULAP. So that is about the surgical part.
Right. So we have medical management, we have surgeries, and those are very and very advanced surgery. So nothing to worry. You just need to go and consult your urologist in case you have these symptoms. Even if you have any male, member in your family who is over 45, 50 years of age and is having these symptoms, please help them consult a qualified urologist. Now, doctor, though we are talking about BPH, though we are talking about the enlargement of prostate, which is completely benign, but still, because prostate cancer is also there, we would like you to throw a little more light over the topic of prostate cancer. What is prostate cancer? What are the symptoms? And are the symptoms similar to BPH?
Okay, if we look the malignancy part, the symptoms will be almost similar to the BPH. Okay, except there is a, if any advanced metastatic malignancy, then there will be some back pain, leg pain, some anorexia and so on. Otherwise, the urinary part, the symptoms will be similar. And if any doubt in the our clinical examination for us, then only we do the PSA report. There is no need of doing the screening PSA report for common people. And if any doubt in the PSA, like raised PSA, generally we do the initial MRI and biopsy, prostatic biopsy, to check whether it's a malignant or not. And if any malignancy, then we follow the protocol of prostatic malignancy, like the staging procedure, CT scan, MRI, PET scan, and then accordingly we treat the disease. Most of the time, patient will have some metastatic malignancy because of the late presentation, and then we have some limited options of like androgen deprivation therapy and chemotherapies. But if any localized disease, then we can go and do the radical prostatectomy like surgery.
We also hear a lot about prostate cancer. People say that this is one of the best cancers. I mean, cancer itself is very bad, very scary. But the silver lining is that prostate cancer spreads very slowly. Is that correct, doctor? And if so, then if it gets detected early, are there chances that the survival rate will increase for the patient?
That is true that the prostatic malignancy is very slow growing tumor. The nature of the prostatic malignancy.
I'm sorry, doctor. Again, I'm not getting your voice. If you just.
Is it okay now?
Yes, yes.
So the prostatic malignancy, it's a very slow growing disease. The nature of this prostatic malignancy is like that it will take years.
Sorry, doctor. Again, I think the volume has gone down. If you can just check once more.
Okay now?
A little up, maybe.
No,
Yes.
from
Yeah, now it is fine.
so the nature of this prostatic malignancy is like nature is like very slow growing tumor. That is correct, and it will take years to present. I mean, 10 years, 5 years, like that. Okay, so that's why everyone is calling it's a good tumor, because even if you diagnose, it will take many years to go into metastatic disease. Okay, so that is first. The second thing is you said the most of the time the people are going to the doctors are doing PSA screening PSA, so it will diagnose earlier. The patient will be diagnosed at the earlier stage, and then once we diagnose, we have to treat. Like patient will be like behind the doctors that you treat the malignancy. So it will be like over treating the patient. You understand? If you are diagnosing the prostate cancer 5 years ago, then the patient will get the unnecessary extra treatment of the malignancy part. Okay, so whenever there is symptoms or clinical examination is showing some doubtful malignancy, then only we have to treat. Otherwise, there will be over treating in the society.
Right. So in case it's malignant, of course, it will get treated. So in case you have these symptoms, because mostly the symptoms are similar, so it becomes even more important to go and consult a doctor.
So just go to the urologist, checked by urologist by clinical examinations, ultrasound and basic things. And if any doubt, you can go for the PSA report as well.
Right. And doctor, do family history plays any role in prostate cancer? If there is a family history of prostate cancer, are there chances?
As I told, there is some risk factor like genetic factors and familial factors. So it's all related with the genes. chromosomal problems, and there is a chance of familial BPH and malignancy as well. But these cases are rare. I mean, the common presentation is because of the age-related issues.
Right. We are getting so many questions regarding BPH from our viewers. I'll take the important ones. Akash is here, and his question is: can BPH cause bladder problems?
Of course, as I said, if there is a late presentation of BPH patient, it will lead to underactivity of the bladder. I mean, the bladder muscles will be weak all the time. So even if we do the surgery, sometimes patient will not pass the urine because of the weak detrusor. Detrusor means it's a bladder muscle. Okay, so it's very important. The both are connected actually. If any prostatic issue, there will be an issue with the bladder as well.
And Ajit Singh is asking, can BPH lead to kidney damage?
Yes, of course. If, as I told, if too much prostatic enlargement and patient not treated earlier, it will lead to hydronephrosis and renal failure if there is a delay in the treatment. So that is possible. And then this kind of patient needs definitely surgery.
And that's why we are continuously focusing on the fact that in case you have symptoms, please go and consult a urologist. It's really important. There's no point in suffering in silence and, spoiling your renal functions, etc. So the easiest part is, because medical management is there, you need to make some lifestyle modification and you can get through it. Just in case you need surgery, there's so much of technical advancements. Again, it's not that difficult anymore. So the most important part is to understanding the importance of going and get it treated by a urologist. So please go and consult a urologist. Now, Dr. Because we are continuously talking about, BPH and why it is important to go and consult a doctor. There are so many people who get up multiple times in the night and they don't know whether it's normal or not. Males, of course, because we are talking about BPH. So maybe they are getting up thrice in the night and they feel that it is normal to get up thrice in the night and go for, avoiding yourself for urination. So my question to you is, what is the normal figure? How many times in the night we need, if we are getting up, is normal, and when we should be, concerned about it?
Only once in the night is only the normal, madam. More than one, like 2 times, 3 times, it's all abnormal, and we have to check it. We have to completely, thoroughly evaluate the patient and then treat accordingly. So once in a night is okay, that is normal, but more than that, it's all abnormal.
Okay. And doctor, again, a very common tendency in our society is to popularize the, drinking water habits, which is good. But then we often say that, drink as much as you can. So many times people will get up in the night, go for urination, come back, have a full glass of water, again go to bed, again get up, go to urination, again come back, have a whole glass of milk and water, and then go to sleep. So my question to you is, because you also said about the liquid consumption and how liquid consumption is a calculation of all the things, tea, coffee, whatever you are having in liquid, form. So how much water, how much liquid consumption is okay, and what should be the pattern? I mean, sipping throughout the day, or having a jug in the morning, or having a jug in the night. What is the right way, doctor?
See, the basic principle is, the first principle is at least you restrict up to 1.5 to 2 liters per day, including all the liquids. That is first. Second thing, important thing is, after 6 to 7 o'clock in the evening, you restrict the fluid up to 100 ml, because most of these patients having lots of frequency at the night, nocturia. So if you restrict the fluid after 7 p.m., there will be a drastic improvement in the nocturia. Okay, so that is the second principle. And most of the time, what people do, they will take 1.5 liters of water, but they will consume lots of fruits and vegetables and other like juices and all. So you have to include all this stuff in the 1.5 liter. Okay, so please remember that. Second, as I told, after 6 or 7, you can restrict up to 100 ml. And please don't drink lots of water. I would say for BPH patients, no lots of water. Otherwise, there will be a more symptomatic problems. So for
Right.
liquid intake, there are two basic principles like restrict total liquids up to 1.5. If your weight is around 80 to 90, then 1.5 is fair enough for the body. Okay, so that includes all the liquids. And secondly, the after 6 or 7, you restrict up to the 100 ml.
Okay. Dr. Nayan, before we sum up the whole session, any take-home message, any do's or don'ts, or anything that we have missed out on and you would like to, tell us one?
For the, I would say for the common people, the take-home message is the first, as I told, if any symptoms, please go earlier with the urologist and check properly. That is first. Don't delay. Don't delay for the urinary problems. Second problem, don't do screening PSA by himself. Okay, if you do screening PSA and if it's raised marginally, there will be unnecessary lots of investigation like MRI, biopsy, and so on. So please don't do the screening PSA. The third important thing, if you are patient of BPH, as I told, follow this fluid intakes, pass regular urines like third hourly, and manage your constipation. Okay, along with the medicine. Only medicine will not work, or only fluid management will not work. Okay.
Right.
And the fourth important thing is, if you have started with the medicine, please don't stop the medication. It's not like alpha blocker is not like you can take for 3 months and then you can stop it. Okay, so you have to take on the daily basis. And if any issue with the medicine, then you have to go for the surgery. That's all.
Right. So, in case you have symptoms, please go and consult a qualified urologist and trust your doctor. That's really important. Go by what the doctor is asking you to do. Thank you so very much, Dr. Nayan Timbadiya. It was wonderful talking to you. Thank you for your valuable time and this very informative session.
Thank you. Thank you very much.
Thank you, doctor, and viewers. Thank you. And for more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.